What medical specialist is most likely to treat TOS? So the first doctor who wrote about thoracic outlet syndrome was a guy named Astley Cooper in 1818. He became a Sir Astley Cooper after that, and he was a barber slash surgeon. I won't go into that too much, but surgeons at the time were different than they are now. Two of the famous people who have their names associated with the disease, Paget and Schroeder. Paget-Schroeder syndrome, or effort thrombosis, when you get a subclavian vein blood clot. Paget was a pathologist and quite famous. And Leopold von Schroeder, I believe he was in Vienna. He was a urologist, a professor, and quite famous in his own right. Then you have people like Michael DeBakey. This is a cardiac surgeon who actually helped design the first MASH units. If you remember that TV show MASH, well, he designed these mobile medical units that took young men right off the field when they were injured and did a lot of work to save their lives. He published on thoracic outlet syndrome too. And this is the way it's been, unfortunately or fortunately, depending on how you look at it. Thoracic outlet syndrome has never been owned by a single specialty. Now, vascular surgeons do tend to work in this area of the thoracic outlet. They handle things like subclavian artery aneurysms or the blood clots that show up there. And so they have, because they know the anatomy and because they've been approaching the area for a while, they have sort of assumed the mantle over the past few decades of handling neurogenic thoracic outlet syndrome because it's in the same area. But that's maybe not necessarily the best indicator to learn what's the proper diagnosis and treatment. So we found that over time, many more specialists have gone into the thoracic outlet and become mostly self-trained experts because none of us gets a lot of this in medical school. I'm starting to see it now in post-medical school internships and residencies and some surgical programs. But usually, of all the people I know around the country, it's the people who picked it up by themselves and said, this is interesting, I'm going to figure it out. So how do you find a TOS specialist? It's not by searching a specialty. Yes, vascular surgeons handle it, but you know what? Neurologists handle it, and sports medicine docs handle it, and plastic surgeons, who are also peripheral nerve surgeons, handle it. So what we recommend, first of all, contact us at Vanguard Specialty Imaging. We're glad to help steer people to a specialist in their area, if there is one, and then to give you a view across the nation of other people. Sometimes it's worth a trip, and some of these people will actually do telehealth consults, and that can really get you started down the road of knowing whether you have TOS or you don't have TOS, and what would be the next specialist to see. Okay, so TOS, because somebody is a TOS specialist, it's not tied into where they trained or what specialty they're in. Just find somebody like me, a radiologist. There's no reason for me to be involved with TOS, except it's a fascinating disease and there are a lot of people who need help. And that's what me and my group of people do at Vanguard Specialty Imaging. We feel we're really making a difference helping people.